Reconstruction with your mastectomy for breast cancer, we will teach you all about it. If you're going to have a mastectomy for your breast cancer, you have an important decision to make. Do I have plastic surgical breast reconstruction or do I not? Remember, first of all, the most important goal is to treat your cancer effectively. But breast reconstruction, when you have a mastectomy by a plastic surgeon, working together as a team with your breast cancer surgeon, is so important to learn about in order for you to make the very best treatment decisions for your unique breast cancer situation. In this lesson, I'm going to go over the different mastectomy surgical options and how breast reconstruction plays a role in your choices for having a mastectomy. I'm going to review with you why treating your breast cancer comes first when you're making decisions with your breast surgeon. I'm going to share with you the important role that plastic surgeons play a role in a breast cancer team, and also go over the different breast reconstruction options available today. And I'm also going to go over somewhat surgery on one side, a mastectomy on one side with reconstruction, versus a mastectomy on both sides with or without reconstruction. So let's get started. So how does a mastectomy for breast cancer and breast reconstruction work together? Well, a mastectomy, let me go over this first. A mastectomy, the goal of a mastectomy is to remove the breast tissue. And really, the way to think about it is we're removing the fatty tissue of the breast and preserving the skin of the breast. So, a simple mastectomy, which means a mastectomy without reconstruction, is where your breast cancer surgeon removes the tissue of the breast and does not reconstruct that. And it does leave you without a breast, flat, and generally an incision across your chest, no nipple and areola. So, but more than 50% of women who undergo a mastectomy undergo breast reconstruction. And that is done as a team with your breast cancer surgeon and a plastic and reconstructive surgeon. So let me explain about reconstruction. The goal of breast reconstruction is to recreate the shape of the breast. Makes sense. So your breast surgeon typically comes in and removes the breast tissue, leaving as much skin behind as possible, and even sometimes the nipple and the areola. And the breast surgeon begins a process, generally best done when you're undergoing your mastectomy, to start the reconstruction process. That's called immediate breast reconstruction. So the surgeon does a mastectomy, removes the cancer, probably checks some lymph nodes, and the breast reconstruction plastic surgeon comes in while you're asleep and begins to reconstruct your breast. Starts that process by recreating the breast with either a prosthesis or using your own tissue. So, a simple mastectomy, no reconstruction, versus a mastectomy with reconstruction. A mastectomy with reconstruction is a bigger surgery. There's more recovery. But the decision process to have reconstruction, in many ways, is a personal one. And the more you know, the better decisions you'll make with your breast cancer team. Next, I'm going to talk about how treating your cancer comes first in all of these decisions. With breast reconstruction,